Good afternoon. Good afternoon, everybody. Sorry I'm a few minutes late. Had a busy call with the governors and then a busy call with the White House, which were important for me to be on, so I apologize for keeping you. And I want to thank you, as I always do, by continuing to tune in to these press conferences. I'll be back tomorrow at 1 o'clock, Friday at 1 o'clock, and then starting next week, we'll be just going to Monday, Wednesday, and Friday at 1 o'clock. I will say there's a good bit of news coming up in the next few days and next week as it relates to what comes next, as it relates to different supports that we'll be providing. So I would encourage you all, if you can, to continue to tune in and also continue to check out reopeningri.com. So we'll begin, as we always do, with the data on the screen. It's, again, another encouraging picture. In recent days, every day we put the data up, and it's an encouraging picture. We continue to see a positivity rate below 5%, which is excellent. You know, our testing is increasing, still testing thousands of people a day, which is a good thing. And the test positive rate is below 5% statewide. The test positive rate in certain communities is still too high, and we're working hard on that. We are laser focused on getting into these most vulnerable communities, parts of Central Falls, parts of North Providence, parts of Pawtucket, parts of Providence, where we have to do better. We have to get that test positive rate to below 10%. We're not there yet. We're laser focused on it, but statewide, less than 5%, it's a good picture. Today we have 107 new cases, and very sadly, again, another 10 deaths. And I would ask all of you, just continue to remember that we continue to lose loved ones every single day to this virus. So even as we move into phase 2 and we have a good handle on it, be vigilant and bear in mind the real suffering that is happening all around us in the state of Rhode Island. Speaking of suffering, it's not only healthcare suffering, there's a lot of economic suffering, and that I'm aware of that. And I wanted to talk a little bit about the deficit that we are probably facing as a state, and particularly we are facing as a state, and particularly about how we plan to begin to address that deficit with our state workforce. As I've said in the past, the deficit that the state is currently projecting is bigger than anything we've seen before, unprecedented really. And if we were to have to close that deficit without additional federal aid, it will be devastating. There will undoubtedly be layoffs and furloughs extensively. We will see cuts to aid to cities and towns, aid to our healthcare system, massive and wholesale restructuring of the way we deliver government services, which is why at the moment I am more focused on continuing to work with our federal delegation, with my fellow governors all around the country, with the White House, with the Congress, pushing for more congressional aid, more federal aid. The deficit in Rhode Island projects to be about $800 million. It's very hard to see how we could close that gap without additional federal stimulus. So the approach I've taken, which we've talked about here, is all signs suggest that Congress is poised to pass another stimulus act. Our federal delegation is fantastic and working very hard on it. I hope that we will have information about whether that happens and the size of that by the end of this month. And then once we have that, we can really get to work balancing the budget. Having said that, in the meantime, it's important that we take as many steps as necessary or as practical in order to keep our costs down. I have said throughout this that letting go of and furloughing state workers in the middle of an economic crisis is something that I was loath to do. I am loath to do. The last thing I want to do is add to our unemployment insurance ranks. So I asked Director Smiley to work with the state employees and their unions to figure out ways to immediately cut cost, but to do it in a way which was humane and delayed layoffs and furloughs, at least until I have a better sense of exactly what kind of additional federal aid will be coming in. I'm very pleased to say that after a lot of work, including throughout this weekend, the Department of Administration announced, I think this morning, that we have come to agreement. We plan to leverage the federal work share program for state employees. The federal work share program uses federal funding from the CARES Act to help us reduce personnel costs, but while minimizing the economic impact to individual employees of the state. It's a voluntary program, but I am encouraging as many eligible employees to participate as possible, because that will enable us to maximize our savings. If you have any questions, members of the press, we can go through the details with Director Smiley. What I'm also saying, and I'm asking that other branches of government, not just the executive branch, consider leveraging the work share program to cut their costs immediately. I'm strongly encouraging them to participate. The deficit is a statewide problem, not just an executive branch problem. So I'm asking the other branches of government, I'm asking the general officers, and strongly encouraging you to look into this initiative. It is a way that you can save millions of taxpayer dollars quickly, but while also avoiding layoffs and furloughs and particular economic hardship for our public employees until we have more information about whether we're going to get additional federal stimulus. I want to, in addition to thanking my own team, particularly Director Smiley, I want to thank the state employees. First of all, I want to thank you for your service. You haven't stopped working through all of this. Some of you have incredibly difficult jobs on the front lines of this. Many of you are working weekends, et cetera. I want to thank you for that service on behalf of the people of Rhode Island. I want to thank you and your leadership for coming to the table over the weekend to come to this agreement. It will enable us to save money in the time that we get some clarity around the stimulus from the federal government. And I would like to strongly encourage all state employees, public employees, to sign up and take advantage of the work share program to do your part to help us manage through these very difficult times with a very difficult, large state deficit. Okay, a few more announcements. I want to shift gears slightly from that and talk for a minute about contact tracing and the Crush COVID RI app, which supports contact tracing. I will say that as I've been up here in the past week, really pushing use of the app, we're getting a lot more questions. And they're very fair questions, right? Like, will you have access to my data? I hear you, Governor, you want me to do this. I want to do the right thing, but I'm nervous about it. What is it exactly? So I'd like to just take a minute to explain what it is, what it isn't, why it matters, and why I continue to ask you to download the Crush COVID RI app and also maintain your contact tracing notebook. I think if I explain it and it makes sense to you, you'll be more likely to opt in. So the number one thing you need to know is the Crush COVID RI app is and always will be optional at all times. Your choice to download it, your choice to use it, and your choice to get rid of it if you decide at any point you don't want to participate. You can use the app with or without the location diary. So at this point, I think we have about 45,000 people who've downloaded the app. I'd like to get that number higher. So if what you're nervous about is this location tracker, then just download the app, but don't enable the location tracker. Maybe you could just do the symptom tracking. Maybe you could just use it to keep yourself informed. Maybe you could use it to find where you could get a test. But please, I'm asking you to consider opting in. When we started to create the app, I told the team privacy was my #1 goal. It had to work. I said privacy and data protection was my #1 goal. It's important to me, it's important to the people of Rhode Island, and I want you to have confidence that no one's going to get a hold of your data. This is what I would like you to have confidence about. Why should you have confidence about? The app does not collect and will never collect any identifiable information. It will never ask for your name. It will never ask for your birthday. It will never ask for your address. It will never ask for any identifying information about you. So whatever data is there will never be stored in a place where it's associated with you, your name, your address, your birthday. Another point I want to hammer home, because we're getting it constantly, this has nothing to do with your contacts in your phone. So most of us have a smartphone, and in there we have our contacts. And people are saying to me, Governor, I don't want anyone to have access to my contacts. So I guess it's confusing because we use the word contact tracing. I want to try to be crystal clear about this point. This has nothing to do with your contacts in your phone. It has nothing to do with that. No one's ever going to access that. We can never get a hold of that. We can never see that. Frankly, I have downloaded the Crush COVID RI app. I don't want anyone seeing or having access to my contacts or my family's contacts. So I hope I can give you some clarity. Although we call this contact tracing, it has nothing to do with the contacts in your phone or any contact information of your friends that you have stored in your phone. If you use the location diary, first of all, you have to turn it on. You can turn it on and you can turn it off. It just tracks where you have been, the locations where you have been. So, but it will not track the people who you have been in contact with. And that is the reason why I'm asking you to continue using your contact tracing notebook to write down the names of the people who you've had access to. So here's how it would work. Let's say you test positive. You will get a call from the Department of Health. They will ask you, have you turned on your location diary? Hopefully you say yes. Then they will ask you, would you be willing to transmit that location diary to the Department of Health? You could say yes, you could say no. If you say no, they'll ask you to read to them. They'll ask you, where have you been in the past 10 days? And you can read from your phone the addresses where you've been. By the way, it's very helpful. You might not remember today that you went to CVS 10 days ago. You might not remember today that you stopped by to visit a friend or see your mother or went to the grocery store 10 days ago. So it will jog your memory. You might not remember what you did 3 days ago. So especially now at this time that we're all so busy and anxiety is high. If you say yes, then it will transmit the list of locations that you've been to without attaching that list to your name to the Department of Health. At that point in time, someone from the Department of Health will go through a very extensive interview with you. It is a painstaking interview, which is why we have over 100 people working full-time right now, many of whom the National Guard, doing nothing but what we're calling contact tracing. They will ask you, okay, you were at your house yesterday, who were you in contact with? And we want you to be able to say, my mother, my sister, my boss, my coworker. And then we're going to reach out to those people and tell them that they have been in contact with someone who's tested positive. And then they can take action. If those people are already sick, they'll be in isolation. If not sick and they were in close proximity to you, they'll be quarantined. We probably recommend that they get tested, certainly if they have symptoms. So it is this is a laborious process, and a lot of people have asked me, like, why I talk about it so much. But the contact tracing is about as important as anything we're going to do, because it will allow us to catch outbreaks before they happen, and it will allow us to prevent widespread community spread as we begin to reopen this economy. So I hope that is helpful. I hope I've cleared up some of the confusion. And for those of you who were still reluctant to give Crush COVID RI a try, I'm asking you again to try it. We are doing all kinds of things we never thought we would do. We are wearing our masks. That's a little bit strange, but it is working. We're keeping 6 feet away. We're not shaking hands of people. We are working from home. I know this is just another thing I'm asking you to do. Keep a notebook of the people you've been with, and please consider downloading the location diary on the Crush COVID RI app. I promise you this is going to save lives. I promise you this will save lives, particularly as we go through the summer, as we reopen the economy, as we get schools back open, as we get to living our life as quote unquote normal, and we're all going to be interacting with more people. My ability to allow us to do that, keep people safe and reduce outbreaks, depends completely on us having contact tracing and testing. Trace, figure out who's been exposed, test them, get them into isolation, and keep a lid on this virus so it never comes raging back. Also, we continue to hear it's a little bit difficult to use on the Android phones. Some old phones it doesn't work with. I hear you, we're working on it, and we're gonna have another iteration soon, like the next version will be coming out soon. So if you keep using it, tell us what you don't like, and we're gonna do our best, and in a few weeks, we'll have a new version and a new release. A couple more points. I think, protests are on all of our minds now as we as a nation see protests all over the country. And yesterday I was asked by one of the members of the press if Dr. Alexander Scott and I are concerned that the protests we're seeing in Rhode Island could cause an outbreak. And the answer is yes. I'll speak for myself. I am concerned, and I know the doctor is concerned as well. This, again, is a difficult situation. It's a fundamental democratic right in our society, First Amendment right, to protest, particularly when we see things that are unjust, wrong, unconstitutional, and we have a need, arguably an obligation, to speak out against that injustice. And so that's why I feel that these protests should be allowed to occur, as has been happening actually for different causes throughout the crisis, the COVID crisis, so that people can participate in democracy and advocate for change. Having said that, it doesn't mean that we can forget that the virus is still with us and that we still have to do everything that we can do in order to keep ourselves safe, keep our families safe, and prevent a future outbreak. So to that end, we have been spending a lot of time recently trying to figure out what actions we could take to both enable safe protests, which are so vital, and also do our best to keep everybody safe and prevent an outbreak. So the following are some things that we're doing and will be doing. Going forward, we will have Rhode Island Department of Health staff present in good numbers at peaceful protests to provide information and resources to protesters. Could be a flyer, could be verbally sharing information. The virus is ever present. The virus doesn't sleep, it's not going away. So we have to be ever vigilant. So we're gonna have members of the Department of Health, probably in a t-shirt, identifying themselves as RIDO staff, providing information about the virus. They'll also be distributing masks. I would ask you, if you're gonna go to one of the outdoor protests, to bring your own mask, but let's say you forget, whatever, you lose it, our team will be distributing masks. Our team will be reminding you to keep social distance, reminding you that the social gathering limit is 15. We don't want you, coming and congregating in big crowds. Obviously, it's much safer outdoors than indoors, but do your best to make your voices heard, which is vital, but keep a distance from those around you and don't show up, please, in a big crowd. And the Department of Health will be gently encouraging you and nudging you to keep that distance. We're going to be encouraging you, they will be encouraging you to download the Crush COVID RI app. They're going to be reminding you to keep a list of your contacts. If you do go to the protest, if you see who you're going to be near, jot down who they are, jot down the friends you went with, jot down the names of the family who you were with, so that if 2 or 3 weeks from now we have a problem, we're going to call you, we're going to ask you where you were and who was in your circle. We're also going to be they will be providing critical information about symptom monitoring and information about how you could get tested. Because if you go to one of these events and then you come down with symptoms, we want you to go ahead and, get tested. And so we're going to be giving you that information at the protest around where you can be tested, what symptoms to look out for. Now, I do want to make a very important point, and I'll do it as delicately as I can. But it's a very important point. After living with this deadly virus for 3 months, we've learned a lot about it. And we know that the virus is very dangerous for people who have an underlying health condition and who are older and who are frail. So, although I will never tell you to not protest and not exercise your rights and not properly advocate for change, I am going to tell you this. If you live with someone who is older, who has an underlying health condition, who is sick, who has a chronic health condition, and you go to one of these protests and you're going to be around a lot of people, I am begging you to exercise extreme caution out of concern for the loved one you have at home who could get very, very sick or worse if they get the virus. So if you're a young person and you say, oh, COVID doesn't affect young people too badly, that may be so. But if you work with someone who's older, if you live with your grandma, grandpa, mother, father, aunt, uncle, if you're hanging out with your neighbor who has diabetes or who has asthma, you have to know, I'm asking you to please be careful so you don't spread your virus to them and they wind up in the hospital or even worse. So just please accept that advice with the spirit in which it's intended to keep everybody safe and prevent any more loss of life on account of the COVID-19 epidemic. Finally, I want to acknowledge and thank the men and women of the Rhode Island State Police, the Rhode Island National Guard, local mayors, and local police forces across the state. They have been working in full force around the clock, and I mean around the clock, to keep Rhode Islanders safe and protect our critical infrastructure. I would say that because of their hard work, their professionalism, their discipline, their training, their courage, they are keeping we, the people of Rhode Island, safe during an enormously challenging time. You just look around what's happening in this country right now. Hundreds of cities, dozens of states, including ours, including Providence and Rhode Island, have been the victim of coordinated, violent, nighttime attacks in recent days. Last night was a very peaceful night here in the state of Rhode Island. It could have been much, much worse, but it wasn't, because we were prepared. So thank you. Thank you to every local police officer who was on guard and on duty last night in Providence, in Cranston, in Warwick, in Central Falls, in Woonsocket, in Pawtucket. We were prepared. Thank you to the Rhode Island State Police for working around the clock, for your courage and professionalism. And thank you to the Rhode Island National Guard. I will say, having been in on all this planning, having been working myself around the clock, and observing the speed with which they were activated, the professionalism with which they operated, and the seriousness with which we met the potential threats in the past 48 hours has been totally inspiring and humbling for me as the leader of these groups. I am in awe of what has happened, both the way the riot was handled Monday night, Tuesday morning, in terms of our ability to limit the damage, loss of life, no serious injuries, and the way last night we, the people of Rhode Island, enjoyed a peaceful night. So I'm getting asked constantly, Governor, are we safe? Where do we go from here? Are we safe? Last night was an overwhelmingly peaceful night. And we are going to maintain, we are monitoring, we are using every tool at our disposal for constant surveillance around the clock. We are as vigilant as possible, and we are going to use whatever resources and means necessary and at our disposal to keep the people of Rhode Island safe. My friends and family are asking me, are we going to be safe? And my answer is yes. We have a lot of professionals who know what they're doing. It is true, I'm not going to lie and pretend that there aren't attacks being planned all around the country, but I am going to tell you, we know what we're doing, we are on it, and I am prepared to do what is required in order to keep Rhode Island safe. And for all of you who worked like crazy these past 48 hours, I want to say thank you. You have made me so proud, and you should be proud of yourselves, and I know you're tired. I will say, I also want to let everyone know that earlier today, the president signed a provision which will extend our use of the National Guard through to August 21st. So I think that's great news. That's great news for the people of Rhode Island. We are relying heavily on our Guard. General Callahan is nothing short of amazing and outstanding, and the people on his team are, I cannot describe how much work they're doing and how quickly they're doing it. Contact tracing, testing, sheltering the vulnerable, taking care of us through the night. I want to say thank you, and people of Rhode Island should know, due to the federal government's proclamation today, we'll have the use of the Guard with the full federal funding through to August 21st. My final comment is this. I took some time yesterday to go around the city of Providence and see the small businesses who were vandalized and whose shops were looted. And our Commerce Department, the state's Commerce Department, is ready, willing, and able to help you. Commerce Secretary Pryor himself and his team did a walkabout yesterday, was in touch with every single business that had been in any way affected by the violence. We are out there contacting every single business one at a time. How can we help you? Really, just how can we help you? You know, is it a loan? Is it a grant? What do you need? We want to be able to help you, every single one of you. On a very personal note, I will say this. It is so heartbreaking to go on those walks, because you go to these small businesses whose window has been smashed in, maybe something's been stolen from them, graffiti on the window, and also you see in the corner their COVID-19 plan, or you see a notice that they just opened. These are businesses that have been closed for months. They are just getting back on their feet. Tuesday may have been their first day of business after being closed for months. And the visual of seeing the COVID plan or we're back open after COVID and a smashed window is so difficult to see. So I just want you to know, if you are one of those businesses, we're going to be with you, and we're going to stand with you, and we're going to support you, and we're going to help you get back on your feet. And to those of you who have been peaceful protesting, stay at it. God bless you and thank you. And I don't want anyone to make any mistake about it. The peaceful protesters have nothing to do with and are totally unrelated to these attacks. And as it relates to the attacks, I don't know exactly when they'll end, but I want you to know we are being vigilant, and we are on it. We have 24-hour surveillance, and we're going to do what we need to do to, as a community, keep ourselves safe and get ourselves through this. So with that, I will turn it over to the good doctor and then come back for questions.
Thank you, Governor. Good afternoon, everyone. Thank you all for being with us once again. In terms of data for today, we have 107 new cases of COVID-19 to announce. As the governor has been saying, we have been seeing a plateau in new cases. The yellow line in the graphic that was shown earlier appears to be going up very slightly. That's because that is a graph of cumulative cases. Each day, our number of total cases, understandably, goes up a little. But when you compare our new cases each day, we are absolutely in a plateau. There are 189 people with COVID-19 currently hospitalized in Rhode Island. This number has also been flat or decreasing as of late. We have 44 people currently in the intensive care unit in a hospital, and 30 of those 44 people on a ventilator. Sadly, we have 10 additional COVID-19 associated fatalities to report today. 2 of these people were in their 70s, 2 of these people were in their 80s, and 6 of these people were in their 90s. Our prayers are with the families of these 10 Rhode Islanders. This has been an enormously difficult time for people throughout the state. Many people are dealing with the loss of routines or the loss of work or the inability to visit family and friends. And of course, many people are dealing with the ultimate loss of a loved one. As the governor has been saying, let's all just try to extend a little kindness, patience, and love to one another right now. With that, there is also the echoing of what the governor said, where public health is honored to support with kindness those who are peacefully protesting about an important issue. Having your voice heard is fundamental to our democracy. It's also fundamental to public health. So much of what we do at the Rhode Island Department of Health is about partnering with communities so they have a seat at the table and so their voices can be elevated. That's true when it comes to racial justice and addressing racial inequities. And it's true when it comes to policies on housing, transportation, education, employment, and all the underlying factors that significantly impact a community's health and well-being, as we're seeing with COVID-19. This is the important difference for us between public health and healthcare. Public health and healthcare are both very important, but public health's broader scope is about addressing all of those factors in our communities that either promote health or that create barriers to healthy living for certain people. In the context of a pandemic, we want to do whatever we can to allow people to participate safely and make their voices heard at peaceful events. Participating safely means wearing a mask, practicing physical distancing, and being aware of the high-touch objects in your environment, and understanding the resources that are available to you how to monitor yourself for symptoms and to get tested immediately, and where to go, and how to keep track of your contacts and access the resources that we have with the Crush COVID app. We'll make more information and guidance available as it becomes appropriate, but we wanted to make people aware today of our desire to stand in solidarity and to support those who want to safely and responsibly make their voices heard. With that, we will get started with questions. I'll give it back to the governor.
Director, how many people can you detail to this? Or how big an effort will this be on the part of the Department of Health?
This is,
and how will they go about this?
yeah, this is something that our employees at the Rhode Island Department of Health, and we'll welcome it from other state employees, are honored to have the opportunity to go and support and help make sure, in solidarity, that people who are protesting have the resources they need to be able to raise their voices as safely as possible.
Is this a volunteer effort?
Yes.
Friday?
This will, for the first peaceful protest that we know about.
Brett, can you kind of walk us through some details on what the work share program is going to look like? How many people potentially? I know you said it's voluntary, so.
Right. So the work share program is voluntary. It's available to all executive branch employees, union and non-union, except for a couple excluded agencies. So anyone that's part of a 24/7 operation, our prison guards, nurses, and direct caregivers in our state hospital, the people on the front line of the COVID response who work for Dr. Alexander Scott, as an example. There are groups that are excluded. Everyone else is included. And we are encouraging volunteers to step forward by Monday. Our target is to see a minimum of 25% and a maximum of 50% participation amongst the included groups. So there's about 8,000 employees in the, what we call the core executive branch, which is executive branch not counting the colleges or the other general officers. We think that there'll be about half of those who will be eligible to participate, so about 4,000. So we'd like to see somewhere between 1,000 and 2,000 employees participate.
And what kind of savings do you think you'll?
If we get a 25% participation, that's approximately $5 million in savings. And those savings grow with the greater participation. And then, as the governor referenced, we are strongly encouraging our other partners in government, the judiciary, the legislature, the other general officers to participate, and we would accrue savings statewide from their participation as well.
To be clear on how it works, potentially a day or two, a week off.
So the program is a 40% reduction in hours, which means if you're a 5-day-a-week employee, you go down to 3 days a week. You continue to receive your state salary for the 3 days that you're working, and you're on work share for the 2 days that you're not working, which means you receive a federal aid check analogous to unemployment for those 2 days. You also are eligible for the $600 a week supplemental pay that Congress passed as part of the CARES Act through July 31st, and the state saves that 40% of their salary.
So theoretically speaking, could some of these people make more money by opting into the program than if they're working full-time?
So it's a 12-week program for the state, starting on June 15th and ending on Sunday, September 6th, the day before Labor Day. And because of the $600 for our lower wage employees, they will likely actually make a little bit more as a part of the program. For the first 7 weeks of the program, while the $600 is in effect, they'll actually make significantly more than their weekly paycheck. But then for the period of August 1st to Labor Day, they'll make less than their weekly check. But we're requiring participation for the entire 12 weeks so that it balances out. The state's able to maximize savings, and we're able to take care of our employees we're not looking to necessarily create winners out of this. We just wanted to hold them harmless.
How significant is the $5 million savings?
In an era where we are looking at terrible choices and need to find savings anywhere we can, this is a good start while we wait for news about additional federal aid. We're able to provide an option for our employees without impacting their life economically at a challenging time, and it is a a smart and responsible action to take. It's not going to balance the budget, but it's a good start, and it's the right thing to do right now while we wait on more news out of Washington.
What other ideas are you floating right now that might, make up for the other 95 million that we're looking to close here? Anything else besides the federal stimulus potential?
So as the governor said, if there's no future federal aid, there's no way to balance the budget with an $800 million deficit without having everything on the table. What we've been focused on, and frankly, going back now several months, is taking responsible decisions now to stop unnecessary spending. There's been a hiring freeze in place for non-COVID or direct care response workers for several months now. There's been a spending freeze for anything that's not crisis related for several months now. This is another tool. So we've been taking steps for several months now as we've seen state revenues fall off dramatically to try to take responsible budget saving maneuvers without sacrificing the services that we're providing to Rhode Islanders and to enable us to still respond to the crisis while we wait on additional federal aid.
Brett, you have a lot of people who are watching and wondering if they're part of this, quasi-publics, things like that, or is that separate?
So the quasis are not included in today's announcement, but similarly, we would encourage them to participate. It's all public dollars. And so if, some of our quasi agencies are going to see reductions in either their federal aid or some participate, depending on what the services that they provide. As a DOA director, I serve on the board of resource recovery. They're seeing a lower amount of revenue because frankly, we're throwing away less waste because businesses have been closed. And so every either a core function or quasi function of government is feeling the impact of the secondary effects of this crisis. And so this is, we believe, a creative and smart way to save money now while there's a unique federal benefit that can make sure that our employees are still in a place where they can take care of their family and meet their financial needs.
Could the General Assembly or the legislative branch take advantage of this program?
They could. We hope they will. They've been briefed on it, and they tell me that they're looking at it.
Governor, you touched on nursing homes yesterday, and I think you had mentioned possibly looking at visitation again in phase 3. Massachusetts announced today that they're going to start some forms of visitation immediately if you go outside with the resident and you stay a certain distance apart. And you said yesterday that Rhode Island in certain elements is doing better than Massachusetts in nursing homes. What's your thinking on that, and does that change at all?
It does not change our thinking, which isn't to say that they're wrong. In no way do I want to criticize what they're doing. I think Governor Baker has his hands full, as do I, and he's doing a terrific job. It's just a judgment call. And we've erred on the side of caution. Almost 80% of our deaths have been in nursing homes. Nursing homes many of them are old facilities. Many of them have shared rooms, shared bathrooms. They're struggling with infection control, struggling with the virus, et cetera. The workers, we hear from employees in nursing homes, they're afraid. So it is not ideal. That I've said so many times. I am almost always faced with two bad options. Option one, enable visitation in some way, which is very necessary for the mental health of the whole family, but I know will cause greater loss of life, for sure. Option two is hang on for a few more weeks, allow us to get a better handle on the infection control in this congregate care setting, ask family members to hang on for a few more weeks, and we just chose that, and we're going to stick with it.
I know you were just on the phone a short time ago with other governors and the White House. Can you just give us a little glimpse into that conversation, particularly with all that's been going on with the protests and these large gatherings? I assume that was part of the conversation today as well.
Yeah, actually today's conversation was pretty much on COVID. The Monday was all about the protests, and we've already covered that. Today, actually, to Brian's question, was heavily on nursing homes. So CMS, the healthcare, Medicare and Medicaid director was on the phone and was really leaning on governors to lean on nursing homes to do a better job with infection control, asking us to ramp up our inspections of nursing homes, to make sure they're doing infection control, every state they went through all the states, every state is struggling with the virus in these congregate care settings. So that was a big focus of the call. A continued push for governors to do more around testing, continued push to look out for our urban communities and communities of color, where, like every state, including ours, is the test positive rate is high. So today was all focused on the crisis and helping us meet the needs of the crisis.
Talk about federal, another stimulus package
There is not a call that I've ever been on where every governor doesn't raise their hand and say, we need federal stimulus.
at all? I mean, obviously, we know where our delegation stands, but
Yeah.
what's the White House saying to you?
So my own view, having been on all of these calls, talked to the president, the vice president, Secretary Mnuchin, something is going to happen, is my belief. Now, if I could predict exactly what Congress is going to do, when they're going to do it, then, I'd be some kind of a magician, and I'm clearly not that. But if you're asking me my assessment, I talk to my Republican counterparts around the country all the time. They are asking for a state aid as much as Democrats are. This is bipartisan. I think there is widespread recognition, including by, the administration, that absent an additional stimulus, you're going to see a lot of, much worse economic conditions. So we're in a recession now. Our ability to pull ourselves out of that recession is going to depend on whether they send more aid to states. If they don't, we're going to add to the unemployment rate. We're going to have to start laying off public employees. So, certainly there have been no promises, but it comes up on every phone call. And, the administration has always evidenced their openness to get something done. Look, I think that Speaker Pelosi, of course, I support her bill fully. I doubt that's going to be the bill that gets through the Senate. But on each passing call, it feels that there's a greater sense of confidence that the Congress will do something. Because, by the way, most states we're up against the clock of a July 1st budget. So I think they're going to do something. I hope they are, and I spend a lot of time pushing for it.
Governor, last night, helicopters in the sky, National Guard vehicles on the street, people see riot sticks and riot shields. As much as people in Rhode Island should feel safe, do you understand why, though, people are on edge?
Of course I do. Of course I do. We all are. In my own home last night, I hear the helicopters. My children hear the helicopters. It is a deeply unsettling time. And I knew when I made that decision to deploy the Guard, I knew the visual that people would see was military-type folks in the streets with riot gear, Humvees, hearing the helicopters. But I felt it was necessary, and I'd rather hear that than what we lived through and what other cities are living through in terms of the riots. So it's unsettling. I hear that. I think it's valid, but it's designed to keep you safe, and it will keep you safe.
You mentioned the big protest plan for this Friday, Black Lives Matter. Have you considered attending the rally?
I haven't thought about it. I certainly support the effort, and I may. It's a challenge for us because we're up here saying no.
You have all this free time on your hands.
Well, exactly, the free time, but I support the cause completely. We are up here saying no groups larger than 15. So I'm not going to lie, we're in a tough spot on this one. I think I would like to be there, and I'm certainly there in spirit and vocally advocating that we take action to finally get rid of institutional and individual racism. Maybe I will attend on the outskirts to show my support, but I also have to, keep people safe, and I don't want to violate my own social distancing rules.
Governor, I know you met with,
repeatedly asked,
This person?
You've repeatedly characterized the rioters as outside agitators. You said today it was a coordinated nighttime attack. And I'm not saying that isn't accurate. But I've gone through the evidence on arrest records and so on from Providence, and I spent some time analyzing that, and I can tell you that of 60 arrestees, 88% gave Rhode Island addresses, 8% gave Massachusetts addresses, and 3% were unknown. And the makeup of the arrestees, out of 60 arrestees, all but 2 of them were under 30 years of age. 6 of them were juveniles as young as 14 or 15. And that doesn't look to me like a profile of outside agitation. That looks to me like a bunch of, frankly, stupid kids filled with anger and rage, acting with antisocial destruction because they just don't know what else to do. And not to, again, go into a history lesson, but in the 1968 Kerner Commission, President Lyndon Johnson just dismissed the report because that's what they said. They said, this is not an organized effort. This isn't the Soviet plot. There's no one behind this. There's no organizer. It's just really angry people who don't know what else to do and are acting harmfully to the society. And of course, the Kerner Commission also said, just as you have, that violence is damaging to society. It hurts everyone. But the rioters, of course, don't understand that. And are you, and I don't mean you personally, but I mean the state of Rhode Island, are you making the same mistake that President Lyndon Johnson did in identifying the cause of these riots as outside agitators and coordinated attacks, when in reality, they look like they're local people?
So let me say this. We don't know is the answer. So you say you've looked at the evidence. This is an active investigation, and we are still trying to figure out who was behind it, where did it come from. It's an active investigation, and we are trying to figure it out in concert with federal authorities, with all of the intelligence gathering that they can do. You are correct, certainly, that the people who were arrested were predominantly Rhode Islanders. And very sadly, a lot of young people, 14, 15, 16 years old. Here's what we also know. The tactics that were used here are eerily similar to the tactics being used all across the country. So it would suggest that these are not just a bunch of, to use your words, angry kids in Rhode Island who are deciding to engage in this rioting. Having said that, we don't know who organized it. State police is investigating it, and we're going to stay on top of it. If you're saying, and so that's where we are, and my job is to protect Rhode Island, to make sure that it doesn't happen, or if it happens, we minimize physical injury, physical harm, a loss of property, and that we do what we can to deter. This has happened, I think, in 120 cities, 26 states. We're trying to, deter them. I will say this. If what you're saying is that there are a lot of people who feel frustrated and angry because they've been persistently the victim of racism, a racist system, poverty, being left out, poor public education, poor infrastructure, lack of access to healthcare, lack of access to education, inability to go to college, you're right. And so we need to do more about that. Healthcare, wages, equality, education. But what I'm talking about now is these were organized attacks on our community. Precisely who did it, we got to figure that out. And we will not stand for organized attacks on our community that create violence and hurt people.
Should they be treated then? I mean, if these are coordinated attacks, should the people charged be treated as part of like a criminal conspiracy? And when I think about that, I think about what Mike just said, which is true, that we're talking about lots of young people. Should they have charges, additional charges added to it?
So that is a better question for the Attorney General. And he has been a great partner to me in this. And he and the state police are working through the investigation. Candidly, the whole country is working through this right now, so you should ask him about his strategy. I will just say this, we need to hold everyone accountable who engages in violence. So if you're in our streets and you're throwing bricks at someone and you're breaking and entering and you're setting things on fire, you will be arrested and you will be held accountable. And the other, his prosecution strategy, I think you can talk to him about.
Are we risking being dragged into an asymmetric conflict, though? Because is there a risk here that somebody posts a flyer on social media that says, oh, we're going to have this big riot at such and such location at such and such time, and we have to send 100 police officers and 100 National Guardsmen? And that's obviously unsustainable in the long term. I understand it's essential now.
No, you're exactly right. So I think we don't know where we are. We, just like COVID, we are in unprecedented times. John just said, you have a situation now where we're lying in our beds and hearing helicopters overhead. We are living through this in the first instance together and learning every day. But my job on a daily basis is to protect Rhode Island. And as more information becomes available, then we'll adjust our response.
Governor, I know you met with Brother Gary of Black Lives Matter earlier today. 2 questions. One, just generally, if you could sort of summarize what that meeting was like for you. And then secondly, in the context of the recent Ethics Committee ruling, will you commit to at least considering or even fully commit to a BIPOC nominee for the Supreme Court?
So I did meet with Brother Gary. I have a long-standing relationship with him. I have a lot of admiration for him and his work. To be honest, I'm spending a lot of time listening to people in the community, whether it's in my office or on the phone with Black pastors, young people. It's time to listen, really listen with humility. And what I hear is, there's a mix of anger in the community, but frankly, also just grief and numbness, a desire to be heard. And the people I'm meeting with who live in Rhode Island, like Brother Gary, like others, they say, please don't mistake us for these folks who are coming in and looting. We actually want to make change to bring about, in his case, better healthcare, better schools, better wages, more equality, affordable college, like opportunity. And so anyway, I'm trying to be present in the community because I think that's important, and also advocate for change. The answer is, of course, I will consider that. I'm actually very proud of my record of diversifying the bench, and I'll wait until I get the list from the JNC and pick who I think is the best. But it's absolutely a priority of mine to diversify the bench, and of course, I'd consider that.
Thank you, everyone.
Bye.